Hello, moms and moms to be. My name is Dr. Johnson Mwangi from Tender Care Dental here in Nairobi. And today I'm going to discuss something very important concerning your health during pregnancy. Hormonal changes in your body actually do affect the gums. You find that in many expectant mothers, you'll find the gums tend to become swollen. They'll tend to bleed more easily and therefore accumulating quite a bit of plaque. You get gingivitis, you get a bit of even periodontitis if things are not taken care of. Now, research has even shown that in severe cases of periodontitis and gingivitis, it can actually lead to a preterm birth. Of course, I don't want to scare you, but I think this is a reality. This is research that if you have severe periodontal disease, you can actually lose that pregnancy out of that. So that is something we want taken care of, we want you to be aware of, and therefore we want it addressed. The other one is during pregnancy, you have another human being growing in you who is taking all the minerals from you, the calcium, and therefore you find all this calcium is being depleted from your long bones, is being depleted from your teeth. And therefore you find mothers will come in with sometimes very sensitive teeth because the teeth have lost a lot of calcium. And in this case, something needs to be addressed. You need to be aware of that. Your doctor, your gynecologist may probably prescribe calcium supplements, vitamin D supplements, and that kind of thing to help ease out on this. The other one that tends to happen, the incidence of dental caries, cavities, tend to increase exponentially during pregnancy. In fact, I remember when I was young, our mothers in the village had a saying that for every child, they had to lose a tooth. So if a mother they used to have 6, 7, even up to 10 children. So you find this mother, by the time they have had their 6, 7 children, literally, they have no teeth. But now we know it can be different. What we normally say is that during the first trimester, the first 3 months, unless it is an emergency, then we try to avoid dental treatment as much as possible. Why? Because at that time, the first trimester, that's when a lot of changes is happening to the developing baby. And you don't want to put stress on the mother, on the dental chair. You don't want to do procedures that can end up affecting the developing baby. Therefore, unless it's an emergency, we try to say, avoid getting dental care. And it's only for the first 3 months. But in the second trimester, between the second all the way, especially to the 6th, 7th month, it is extremely safe to get any dental treatment done in the dental office. You'll get your cleaning done, your fillings done, even a root canal doesn't have to wait until you deliver. We'll still go ahead and do it. But what we'll also do, of course, we will try to keep your appointments as short as we can because we don't want to put stress on your body during that period. During the last trimester, that's the last 3 months, or especially the last 8th and the 9th month, of course, even that one, unless it's an emergency, then we try to avoid doing much any dental treatment at that, because we can always wait for another 2 to 3 months before you can come back. Because at that time, of course, doing a difficult extraction, we don't want to induce an early birth or induce labor in the clinic before you are due to deliver your child. Yes, mom, what about at home? What can you do during pregnancy? One, if you can cut down on the very, very sugary stuff, I think that would be quite important. Then the other thing is because you want to eat healthy, just for yourself and also for your baby as well. So you want to stay on the healthier side of the diet. You want to brush your teeth regularly. Make sure you brush your teeth in the morning. Make sure you brush your teeth at night before you sleep. And of course, we always know that the night brushing is the more important because you spend the whole day eating. You don't want to sleep with that. So please ensure you brush your teeth at night. For those ones who sometimes are very sensitive, and we understand that, There are some ladies who can't even sometimes put a toothbrush in the mouth, especially the back teeth, because they tend to kind of be very sensitive around that time. That means a mouthwash, a regular use of a mouthwash during that time to help bring down the amount of bacteria in the mouth, that would also help. For those mothers who experience morning sickness, they tend to bring back, regurgitate a lot of stuff during that morning sickness. They tend to vomit. So that means they bring in a lot of acid back into the mouth. And that acid sometimes can end up with a lot of erosion of the teeth and causing a bit of cavities and sensitivity. So rinsing your mouth with, especially if you can't brush your teeth, rinsing your mouth with a good neutral mouthwash will actually tend to neutralize and help cut down on the effects of that morning sickness. Drink plenty of water. Yes, during pregnancy, drink as much water as you can. Of course, this is for everyone, but I think even during this time, I think you need to drink as much water as you can.